Welcome to a PEDRA publication presentation. This presentation is an overview of a peer-reviewed collaborative study and is not a substitute for medical advice, diagnosis, or treatment. Any decisions related to medical care should be made in consultation with a qualified healthcare provider. This presentation, Incidence of and Risk Factors for Keratinocyte Carcinoma After Pediatric Solid Organ Transplant, is brought to you by Dr. Muskan Sachdeva.
Hi everyone, I'm Dr. Muskan Sachdeva, and I'm a first-year resident at University of Toronto. I'm going to be talking to you about my study that I completed last year. It's called Incidence of and Risk Factors for Keratinocyte Carcinoma After Solid Organ Transplant in Children. I know it sounds like a mouthful, but we're looking at how common are skin cancers after getting organ transplant below the age of 18. There are many people who helped me with this project. Their names are listed on the slide as my co-authors, and my supervisor was Dr. Catherine Sibold. So the first question is, what is keratinocyte carcinoma, short for KC? It is a type of skin cancer. It includes two skin cancers, which are called squamous cell carcinoma and basal cell carcinoma. These two are the most common skin cancers after getting an organ transplant. So what did we look at or want to look at? We know that in adults, the chances of getting keratinocyte carcinoma after an organ transplant is high. However, we don't know what happens in children. So the question becomes, when children get organ transplants, are they more likely to get a skin cancer? That is the question we are hoping to answer with this study. What did we do and how did we answer that question? We looked at some data from insurance databases from May 2021 to December 2021. We looked at children who received their organ transplant before the age of 18 and those who were living in Ontario, Canada. So what did we find out? We included 951 patients, 54% of which were males and 46% of which were females. Remember that these patients were living in Ontario, Canada, and had gotten their organ transplant before the age of 18. The transplants were kidney, liver, heart, and lung transplants. Out of the 951 patients we looked at, 10 of them had skin cancer after 13 years of getting their organ transplant. The most common organ transplant in those 10 patients was kidney transplant. 5 out of the 10 patients unfortunately died. Key finding here is that children are more likely to get skin cancer after getting an organ transplant. However, please note that we need more research to say this for sure. We're basing this conclusion on our study, which only looked at 951 patients living in Ontario, Canada. We want more studies with more patients and those which are looking at other provinces and other countries so that we can make a stronger conclusion about this. Let's take a look at what other researchers and other people had to say about this topic. Other studies have found that skin cancer risk increases after getting an organ transplant, especially kidney transplant. But this might be because people take certain medications to weaken their immune system after getting an organ transplant. So it is really not clear if skin cancer is occurring because of organ transplantation or because of the weakened immune system from medications, or both. Another point that is often raised is that males are at a higher risk of skin cancer. But this can be because males may spend more time in the sun at work. Again, it's really hard to say exactly why this is the case. Lastly, fair skin can put someone at a higher risk of getting a skin cancer as well. So how can the risk of skin cancer be decreased? We made this infographic that shows 4 steps on how skin cancer can be reduced. Again, this is just what we have been suggesting to patients and children in general, and it's not based on research that is thoroughly done with large sample size. So the first is to avoid the sun from 10 to 4 p.m. when it is at its peak. Always seek shade, avoid tanning boots. Number 2 is protect. Wear a broad-brimmed hat, use sunglasses with UV filter, apply sunscreen that has an SPF greater than or equal to 30. Examine is the third step. Perform monthly self-skin exams. Look for any changes in size, shape, or color of any moles. The last step is to seek care. See a dermatologist before transplant and then every 1 to 2 years after transplant. This is a similar infographic for your doctors, and it's looking at the same 4 steps. The first is sun avoidance, the second is sun protection, third is examining yourself, and lastly, visiting your dermatologist. So what did we conclude? Again, based on the patients we looked at and the children we looked at, we saw that skin cancer does increase after getting an organ transplant. However, we need more data to see what happens in other patient population in other countries. We also need data to see if sun protective behavior, screening, and education could help decrease this risk. Thank you very much.